Hello, beautiful souls, and welcome to another episode of the Indigo Womb Wisdom Podcast. I'm your host and sister friend, Shatia Tee Owsley, and thank you for watching and or listening. So sit back, grab some tea and a notebook, and let's vibe together as we have organic and practical conversations embracing intuitive womb wisdom, spirituality, and a sprinkle of magic to rebel, restore, and radiate overall wellness in our lives. Hello, everyone, and welcome back to another episode of the Indigo Womb Wisdom Podcast. I am your host and your sister friend, Shatia Tee Owsley, and today I would like to introduce our guest, Dr. Jalan Burton, better known as Dr. J. Dr. J, as she loves to be called, is a pediatrician, a wife, and a mother of three with over a decade of experience in well and sick child care, complex care, children with special needs, public health, youth development, and managed care. Dr. J is a proud University of Virginia graduate. She attended Columbia University for her Master's of Public Health degree and the George Washington University School of Medicine. She completed her internship and residency at the University of North Carolina Pediatrics primary care program. And as the lead physician and the CEO of Healthy Home Pediatrics, Dr. J collaborates with families to provide comprehensive primary care that integrates traditional evidence-based interventions with customized plans that prioritize healthy food, quality sleep, integrative medicine, and healthy family routines. Dr. J, welcome.
Thank you for having me.
I'm so excited for you to be here today. I know your schedule is super busy. And listen, y'all, Dr. J had a baby she had to see today. And she said, Shatia, we're going to have to work it out. And I said, whatever time you can give me, I'm going to take it. So I'm so happy you were able to be with us today. I read a little bit about your bio, but Dr. J, you are doing some amazing work and some amazing things in the Washington, D.C. metro area. So please, I want to turn it over to you. Introduce yourself a little bit more. How did you get started? What is your story? And let's just vibe and see where this convo goes today.
So thank you so much for having me. The universe keeps bringing us back together, and I'm like, let's cook up some things.
Yes.
So I have always wanted to be a doctor. I'm one of those people that, like, when they were little, they were 3. I think my mom has a picture of me when I was 3, and I asked to be a doctor for Halloween, and all they had was nurses' uniforms. And I'm like, no, ma'am, you need to redo this. So my mom sews, so she redid the nurse's uniform into a doctor uniform, and I was a doctor. And I've always wanted to do it since then. So the Dr. J comes from Julius Erving, the basketball player, because again, telling my parents that when I was 3, I wanted to be a doctor. My dad was like, okay. And he's been calling me Dr. J my whole entire life. So I always knew I wanted to do that aspect. As far as like working with kids and families, I think it's just always been in my DNA. So like my first little job was being like a mother's helper when I was 11 or 12 for the neighbors across the street. And then I was a camp counselor. And then I just kept doing all this camp stuff. And it just continued into college, into like youth and reproductive rights and things of that nature. So always wanted to do something in healthcare, always knew I was going to be a doctor. But I think seeing the way that people were treated in my community, seeing the way my grandparents were treated sometimes when we would end up in the emergency room with them, and how people would be really dismissive and just downright mean to them. And then seeing how as soon as I went to medical school, you know, Black grannies, if you end up taking her to the doctor, taking her to the emergency room, she'd be like, oh, my granddaughter is, going to be a doctor. People's whole vibes would change, like the way they talk to me, the way they talk to my grandparents. And that started pissing me off.
Yeah.
And so I was just like, okay, first of all, I need to backtrack a little bit, right? Like we keep hearing about all these health disparities and things. And, in high school, I'm in all these pre-med programs. We're learning about all these health disparities. I was like, how do these keep existing? Like, why is this okay? Like, who thinks this is okay? And I was like, I'm clearly not going to get those answers in medical school because they're doing the things that are causing them. So I decided to kind of take a little pivot and went to public health school in New York City. And so I studied health promotion and program development because I'm like, I can do one-to-one all day. I can talk to people all day about health. I can talk to people all day about healthy families. But I'm like, how can we develop programs for communities? How can we develop programs for my community, right? Like that nobody wants to serve in. And how can we change things? Because the traditional tools that we're using are not working. Health disparities were bad when I was in high school. They were bad when I was in medical school. And now they're worse. So I'm just like, we're spending more money than any other industrialized country in the world. I'm like, make it make sense. Like, we keep doing these things that are not advancing health outcomes for any of us. And I was just like, I just need to backtrack. I need to figure out how to develop things on my own, like looking at the problems that my community is having. So that is what led me to public health school. And that's ultimately what led me to found my practice. Like, I did not ever think I was going to be an entrepreneur. Like, I was like, I'm going to work at somebody's clinic in the hood forever. I'm going to work in somebody's urgent care forever or emergency room. And how I got into that system, and I was just like, nah, like, I'm not doing it.
So was there so there were so many defining moments that you were like, oh, okay, yeah, this is not going to work. I just can't see myself in the hospital. Knowing that clearly it was a calling for you to go into entrepreneurship, even though Dr. J, you seemed a little resistant, like, that's not where it's supposed to be. What was the final straw that you said, okay, I'm going to stop fighting it. I'm going to stop fighting it. This is where I'm supposed to be.
I'm going to share the final straw. So I think it was like the little seeds getting planted, just like you said. Like, it wasn't initially a defining moment. Like, it was like the little seeds that kept being planted, the little frustrations, the little inkling of like, maybe this system is not set up for you. Maybe this traditional stuff isn't set up for you. And so I think the final straw was I ended up working for this physician. I'm not naming names. I'm not giving details because I don't burn bridges. She was a Black woman and a pediatrician and someone who I thought was going to treat me very, very well. And I had our son, who's 7 years old, has special needs, and he was having issues with breastfeeding. And so I'm pumping everything I can. We had a donor, like one of my sorority sisters donated like hundreds of ounces of milk because she was an overproducer. And I'm literally like making every single little bit of milk that I can for this baby, right? And the tech who was working with me at the time, the medical technician, she was breastfeeding one of her children for the first time ever. Like, she'd never breastfed her other babies before, but she was breastfeeding. And this woman was doing so well. And, I was supporting her. We were supporting each other. And I remember we were advocating for ourselves in this private practice owned by a Black woman, pediatrician, thinking like, if anybody's going to have our back, she's going to have our back, right? Like, so I said, it would be great if we could close for 30 minutes so she and I can pump for our babies, like, right? Like, our babies are little, my babies have special needs. Like, we're doing the best we can to provide for these babies. And she tells me, no, the law is that we can't close the office down for you guys to pump. Wait, I know that's not the law. Like, that's not the law. The law is actually you're supposed to give me time to pump. And I said, I've never heard of that law before. But we will work through our lunchtime. We'll work through our pumping time. We will eat, we will pump, and we will type, right? Because I'm not like, while I'm pumping, I'm not just sitting there with my feet up. I'm calling pharmacists. I'm writing prescriptions. He's checking vaccine records. We're doing stuff, right? I'm like, shoot, we could even pump in the same room and be like talking to each other and it not be a big deal. And she said, no, we're not going to be able to do that. And so I said, okay. So the tech stopped pumping because she was like, I need all my money. And I'm like, I'm going to pump. You don't have to close the office down, but I'm going to go when I can go. And so I went, and my check was $325 short one week. And I said, like, ma'am, like, check this. Like, my check is short. And she wrote in an email to me that I was docked my pay for excessive pumping at work. So that was the final straw for me. And I put my notice in maybe 3 or 4 weeks from there. Like, I cried, right? Like, I was devastated and hurt. I was hurt that the other staff member had given up on her pumping journey. And then, babies started having all this constipation issues, as we know, right? Like, babies are supposed to get as much breast milk as they can get. But I was like, as the doctor, like, I'm going to keep pumping for my baby because I know how important this is. And I said, in my response to her, I wrote an official letter. I have never pumped and not done work. So I am working and providing labor for you the whole time that I'm pumping. My money is very important to me from now I will make sure that my invoices reflect all the phone calls and all the things that I did during pumping. And I think I put in there, this really makes me sad. Like, I'm really disappointed. Like, I put some kind of words in there, but I also needed my job, right? Like, we're all laborers, we're all workers, and the system is crushing all of us. So I needed my job. I couldn't say too much. My husband's like, babe, I got your back, pump for the baby as long as you can. But like, you do need your job. And it just showed me that, again, like, the system is not set up for us to thrive. And it didn't matter who the boss was in that system, right? Like, unless they have explicit policies and explicit politics that are supportive of families and babies, they don't really care, right? And she told me, like, this had never, like, nobody else had ever had a problem before. She had breastfed all her babies and everything had been fine. And I'm just like, no, this is not a supportive environment. And so I left. And what did I do? I had already been working behind the scenes, doing my research, setting my stuff up. So once I got that, it was just like the universe was like, girl, I told you to go. So now you just really want to know that this woman will really, like, kill you and your baby and not even blink an eye. And I was like, okay. And then we go. And I have been committed since then to be an equitable boss, to have a just practice. My maternity leave was the bomb when I had another baby. I won a breastfeeding award for having, like, a gold standard breastfeeding supportive, workplace. Cause I was like, we can do right by people. We don't have to do them wrong. And when we do right, people will come back and want to work with you forever. Like, that's one of the things that I don't understand about the system. It's like, you will have better work when you support people. You give women and families really, really good medical leave and you pay them really, really well, they're always going to come back.
They will be committed.
Have left, and then they've been like, girl, I can't work over there. Can I come back on the team?
Yes.
New team members that have done that.
Yes.
You know what I mean? And I'm like, heck yeah, I was sad when you left because you're excellent, So I'm hoping, one of my hopes, one of my shifts now, transitioning into my coaching services for women, it is like, y'all, we can do this better than it's been done. And let's show them.
Yes.
Like, let's build what we need and let's show them how we can do this.
Yeah.
So.
Yes, I love that. And you were so right. How many times have we heard people stay at a job for years? They stay there for years because they were like, I don't know if anybody's going to treat me the way that my workplace treats me, right? The benefits are good. My supervisor is amazing. They're understanding. They're supportive. I get my promotions. I have opportunities for growth. There's learning opportunities for me. People will stay and be loyal and be committed when they know that you care about them and work-life balance, which is extremely important. And I feel like it's even more important now than it has ever been because there is just so much stuff going on. And I know for me, I know a couple people who their employer offer mental health days, like they're built in. Take the day, take a mental health day. And so I'm so excited. So let's talk about the practice, Dr. J. Let's get into the beginning of the rollout, how it happened, and what is the practice all about and what makes your practice so different?
Just started doing it. You know what I mean? Like, literally, like, it wasn't, I wish I had $100,000 or, like, some people who we won't name. I had $1 million handout from my daddy. That would have been nice, right? Like, that would have been real nice. If I had that handout from my family, shoot, we'd be over the country by now. But it was literally just like making the decision to just, like, open. And I found a team. So one of my line sisters was my first accountant and bookkeeper. Found one of our friends was a small business attorney. You know what I mean? It was like working within the resources that I had. It was listening to podcasts, reading books. I love reading. I read like 25 books a year. Like, I love it. I'm just like, give it to me. I'll take it all. It was talking to other friends who had started businesses and just being like, there's no perfect time. There's no perfect anything. Like, you do it. So I literally just got in my old little Kia Spectra and started doing my little house calls. I wasn't charging enough, but I was happy and I was doing it my way. I was like, we call it moonlighting in medicine, but it's side hustling. Everybody calls it side hustle. So my practice was my side hustle for 2.5 years. So I would drive up to a different clinic. I was working in the hood in Baltimore. I drove up to Baltimore for a year, and no, it was close to 2.5 years. And I would just go there 1 or 2 days a week and work in a little clinic that didn't have a doctor. And it will remind, like, I love the patients, but it will remind me of the systems that like don't work for me. Like, I just was like, I'm already getting in trouble for taking too long with patients. Like, come on now. Like, these are really sick patients who haven't had a doctor for years. And I just got to see patients in their homes. I'd have, 4-year-olds running to the door being like, Dr. J, taste this pepper. And like literally like putting peppers in my mouth, like kids who didn't eat vegetables before, but who I had like worked with their family and coached their family. And now they're like literally shoving, peppers in my face so that I could eat them because he loves them now and he didn't love them before. But Dr. J told me to try this and mommy's telling me Dr. J wants me to try this and I do. And now it's working. So it has been such an amazing journey. It can get lonely, right? As like a solo entrepreneur. So I'm always doing my best to like build community and meet people. It can get overwhelming, like the administrative burdens, you know what I mean? Like, and like making all the decisions yourself. Like, do I use this paper or that paper? I don't know. I'm not using any paper today. I'm just putting on paper. I'm not doing it. But it's also been like such a joy because I'm like, we're at year number 6 now. And like, we're in like the multiple 6 figures, like, and at this point, I'm just like, I'm trying to make $1 million company because like, literally, like all the books say when Black women, when we are financially stable, when we are flourishing, we bless everybody.
Yes.
And so I'm like, I gotta be a millionaire because the millionaires that we currently have aren't thinking about us.
Right. Right.
They're not thinking about us. They're shutting clinics down left and right. People who depend on all this federal funding, they might be gone, right? Like they could be gone tomorrow. And I'm like, we have to, if there's ever a time, we have to build the things that we need and want. And again, going back to those health disparities, so many of these clinics get these $1 million contracts every year. Show me what improvements they've made in health. Show me how they've improved things in my community. Show me how we're, decreasing infant and maternal mortality. Give me a little slice of that. I'm not asking for the whole 2 million budget, but like, give me 250, give me 500. I bet you I can show you full compliance. My patients are asking me for stuff before I've even had a chance to think about it because they know I'm going to listen to them. Dr. J, hey, I read this article about XYZ. What do you think? Can we try this? I'm like, sure, let me read it. Let's look into it. You know what I mean?
Yeah.
Like, I don't know if people, again, I'm so excited at this phase of like being like showing other people how to build businesses like this because like people want it. People want access to trusted people. They want integrative medicine. They want to be well. They want to get off all the medications. And I'm like, I know so many physicians who are like outstanding physicians, but they have almost been like restricted in the environments that they're in.
Yeah.
One of my best girlfriends today, she texted me. She said, girl, I'm thinking about being an entrepreneur. And I said, yeah, ma'am, you would be dope. Like, you'd be so dope. And I'm like, you're an internal medicine doctor. So like, if you want to come be on my team, let's go. Because people want you and people need you. Like, it's, I can't think of a better time for people to figure out the things that their community needs and figure out how they can be the answer, be the solution for those things.
Yeah, absolutely. So let's just go back talking about more so the integrative health portion. For those who are not familiar with the term, Dr. J, can you explain what integrative health is and what it looks like in your practice?
Yeah. So, I mean, one of the things that I think a lot of times people don't realize, and reading so much helps me really understand it, is like our country and Western medicine are relatively new, right? Like it's not, we've always done it this way. No, we've done it this way for, 500 years, a few hundred years. But before and in other places, there are completely different models. And again, going back to the United States, like we lead in health disparities. We lead in infant mortality. We lead in chronic diseases like obesity and dental decay and high blood pressure and high cholesterol. So again, it behooves us to look elsewhere and make sure that we are integrating it into the things that we do. So again, Western medicine is one of the newest systems of medicine. And yes, we have advances, we have, technologies that are helping a lot of people, but we also aren't, like, people are just dying of, poor nutrition. People are dying of stress, right? Like heart disease, lung disease. People are eating things and drinking things that they shouldn't. Our environments have gotten more unhealthy. So integrative medicine, if we, so our system is really based upon like, I examine you, I see what's wrong with you, and I diagnose something to get you back to where you like to optimal health, right?
Mhm.
And sometimes I can't get you back to optimal health, but I can try to get you as close as I can. So integrative medicine are usually systems and practices that help and support the bodies in different ways. So it could be nutrition, it could be supplements, it could be probiotics, it could be mental health strategies that are different, right? Like Reiki, which is a modality that uses like your energy, your internal energy to shift things. I've used Reiki before. I'm a Reiki level 1 provider. It's really helpful. And yes, it's very woo woo, but y'all, it's been here for years and years and years. So if you just let somebody shift your energy around, it's not going to hurt you as long as you got the right person,
Yeah.
right? It may get you off of some of the things that you're on. Other integrative medicine, chiropractic care. So, I work a lot with expecting families and new mamas, and chiropractic care can like save tremendous amount of pain and discomfort, right? In my own pregnancies, chiropractic care, I mean, I was there every single week and sometimes twice a week at the end of pregnancy. Your hips are popping out of place, your joints are uncomfortable, the baby's weighing down on you. The chiropractor is, shifting you back into places. And it's not everything like you see on TV and on YouTube. It's not a lot of crack, 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 but it's just like, let me get you aligned, The chiropractors that I use, there are 3 in the area who focus on pediatric patients, and it is very controversial in medicine. I don't want to pretend like it's not, but the pediatric chiropractors that I know, there's no popping, there's nothing. It's stretching, literally baby massage to like get some of the joints. It's teaching parents how to do like belly massages and stuff like that. So the chiropractors that I trust is very safe, right? Like if I ever heard that they were like adjusting and cracking babies, I'd be like, yeah, I'm not sending anybody to you ever again, right? Because they shouldn't be cracking babies, but they're just moving them and manipulating them. Other integrative medicine modalities are like sound meditation, which I haven't done that yet, but I'm so excited to try that hopefully this summer. Forest bathing, like we live right near Fort DuPont Park, just walking through the park, being in the sun, gardening. I do a lot of gardening. So all of these things have to be in our bag of tricks to get people to optimal health. So I refer people to like the majority of my patients use integrative medicine. The majority of them use, and I didn't mention like herbal supplements and things. So I'll be taking some herbalist classes hopefully soon. I've used tinctures before, different herbs. A lot of people use them and people don't think they're using integrative medicine, but they are, right? That mommy lactation tea, right?
Mhm.
Mommy supplement, those pills that you're taking, all of that is herbalism. All of that is integrative medicine, and it's huge business. A lot of people are using them. It's controversial. I have some medical colleagues who are like, oh, that's quack medicine. Like that's, what do they call it? That's something snake oil. And I'm just like, y'all, so many people are using it. You need to know what they're using so that you can tell them to stay away from the dangerous stuff and
Right.
just have a few that you're okay with. Honey for a cough for kids, that's integrative medicine. That's nutrition-based medicine. So all those things, most of us use them, y'all.
Yeah.
We should find out the best ones that work for us and our family.
Absolutely. Oh, that does my heart so good, Dr. J, because I am a practitioner of many of the things that you mentioned. And so I love to hear of how you integrate or even recommend those different modalities because they do work when you have the right practitioner. So yes, I definitely agree with you on that. Can you give us a story without giving us any confidential information about how you have seen one of your babies just progress in a positive way? Or can you tell us a story about how you had a little one come in and you kind of mentioned one about the peppers. They weren't really big on vegetables. And then all of a sudden they are just, in love with peppers. Is there one story that sticks out to you that just does your heart good? And I'm sure you have a lot, right?
My patients are wonderful. I adore them. I love them. The last patient that I just saw before I ran to get on here with you, while I was examining her baby sister, she's like, I love Dr. J. And I'm like, I love you too, girl. Her mom is like, girl, 2 seconds ago, she was saying she didn't want you to come over to the house and see her, but now she loves you. And I'm like, that's fine. That's fine. That's fine. I heard I love you, so I'm gonna go with that. So, I mean, I see a lot of different ages of patients, but I think one of the most, I guess, like life-changing things that I do, I do a lot of work with pregnant and expecting families, getting them ready for birth. I have a fourth trimester package where I'm just working with families in the prenatal time up until they're 4 months old. And then I transition them to a pediatrician that's within network, for example, right? Because like my services, like it's going to cost you for me to come to your house and do everything at your house and, leave equipment at your house and stuff like that. So I think when I get in my prenatal visits, I try to do them between 32 and 36 weeks. If a patient interviews and I already hear that they're having like pregnancy complications, I'll be like, so let's have your prenatal visit at like 32 weeks, right? Because sometimes like mamas will literally go into labor that day, like preterm labor. And it's like, okay, right? Like, I'm glad I did this visit early with you. I don't have any 32-week babies, but I've had a lot of 36-week and 37-week and 38-week. And during that prenatal visit, it's not so much like emergencies and things like that, but it's like, who's going to support you? Like, I know I'm going to be a part of your community and your village, but like, you're not going to call me to be like, hey, I need you to come watch this baby for an hour. Cause I'm not going to come watch your baby
Right.
Cause I have 3 kids of my own. And when I'm not seeing my patients, I'm right here in my garden. But like, who are you going to call when it's not in medical emergency, but you just need support? And so sometimes I get on those calls and it's the first time anybody has talked to them about that. They're like, I didn't read my books. I'm getting my pediatrician. I got my OBGYN. I've got, I know when when I go into labor, what I'm supposed to do. And I'm like, but when you come home and you can't walk because you need to rest, who's going to do your laundry? And what are you doing for food? And like parents often haven't thought of those things.
Right.
And so, I have a checklist. I go through it. I talk to them about laundry. I talk to them about food. I talk to them about rest. And then again, I put it in the context of, yes, I know you're reading all these fancy bloggers with these big houses and this beautiful marble floors and stuff, but like the United States is losing in terms of infant and maternal mortality. So how are you going to do something different than maybe what you see a lot of people doing?
Mm-hmm. Mm-hmm.
And they're like, I hadn't even thought of that. And I'm like, okay, well, that's my job, right? Like my job is to make sure that you are the healthiest mama and that this baby is the absolute healthiest. And that once you're home, we keep you home. So I wouldn't say it's a particular patient, but it's like a particular set of patients that, they are, my patients are like top of their fields. You know what I mean? Like they are running things. They've been running things forever. And I'm like, having a baby is the hardest thing I've ever done. And I have worked 120 hours in the intensive care unit taking care of critically ill babies. And they're like, so you think having a baby is harder? Yes, I do. I think having a newborn at home that you are trying to exclusively breastfeed is harder than like working in the hospital all those hours. Because at the end of the day, I get to check out to somebody else, right? Like I'm done for the day. Hey, baby Q has this, and this is on this feeds. And now I'm going home to sleep. You can't do that when it's your baby.
Right.
You can't do that. So I think that has been some of the most profound work that I've done. I think taking my time with people, prioritizing their experiences. Like I developed like a communication sheet that I use to remind me when I'm at my visits. And the communication sheet always starts with the family's priorities for when their kids are little. And then when they get to be 12 and above, it's actually 10 and 11 and above, the patient's priorities come first. And I say to the parents, my teenagers and my tweens, like, okay, I'm going to talk to Billy first because he's the patient. I'm like, Billy, the most important person here is you. And they're like, what, girl? What? So, Billy, what is the priority for today? And they usually just look at me and give me a face like, I don't know, Dr. J. And I'm like, is anything worrying you? Nope. Anything you want me to check? Nope. Any part in your body you want me to look at? Yeah, I got this bump on my butt and I need you to see it. You know what I mean?
Yeah.
But like, you're the priority. Your mom doesn't get to tell me what your priority are. You get to tell me, Billy. And I even do it for some of the younger kids, some of the ones that are like really with it, some of the like the little 8-year-olds. It's usually 8-year-old girls with little attitudes and stuff. I'm like, so girl, what you want to talk about today?
Right.
"Oh, okay, girl, nothing. I'm fine." And they kinda look at their mom like, "Why is she talking to me?" I'm like, "'Cause you're the patient and you're the most important." And they're like, "Oh." And then they get a little less mean, you know?
Right,
Yeah,
right.
I think all of that is important, and I hope that I know people might not be my patient forever. They, may have to their insurance switches and now they're not getting reimbursements. That's usually the number one reason why people leave the practice, but I hope that I am planting seeds to let people know that we all deserve better.
Yeah.
And I'm like, even if I'm only gonna be your doctor for this one visit, you're gonna know that you are the priority and that you're really important. And so hopefully the next time you interact with somebody who doesn't treat you like that, you can be like, well, my last doctor used to talk to me and I'm gonna need you to slow down, or like consent for my teenagers. Like, I'm like, so first of all, are you okay with me doing this? And then I'm gonna ask your parent, right? Because you're the patient. So I hope that it, plants some seeds for them. Like, my pediatrician needs to take their time and talk to me.
Yeah. I think that's so empowering because in a world where there's so much information, there's so much stuff going on, our babies, our children, our families, just in general, have to have the tools to be able to speak up for themselves. And starting as early as possible is the best way to do that. And so it's not stuff being done to them. It's a conversation. It is a relationship. It is mutual respect. And they're learning it early that they have body autonomy, they are being heard, they are being listened to, and that goes a long way, even outside of the doctor's office, right? And so I just love Dr. J. So let's just kind of go back just a little bit. I would like for you, because I saw the passion. I mean, I see the passion in all the work that you do, but I see the passion in your eyes when you talk about optimal health and support during the fourth trimester, right? What does that look like? What is that? And I know it is individualized. It's going to be different for every family because there are different support systems, there are different needs. However, there are some core basics, I think, that every family should have in place when they transition from, their birth, from bringing that baby earthside. And so, what does optimal support in the fourth trimester look like coming from Dr. J?
So I am so passionate about this that I am launching a newborn course actually next month. Well, I'm launching a newborn course in July because I just am like, I want this message to get out to so many people. It's not just about what happens when you're at the hospital, but it's like what happens after, right? So optimal support, again, and we need to re-envision, right? I'm always like, yeah, we do things here a certain way and I can give you the optimal, but my vision is even bigger than that, right? Like, my vision is when we look at all of the other countries with lower infant and maternal mortality rates, right? Number one, they all have a publicly funded healthcare system. So I'm just going to say it. We need that. We need it. I would sign up for it. Yeah, it might shift the way I get paid, but guess what? Like, we know that people do well when there is a publicly funded system that covers us all for the things that we need.
Mm-hmm.
Our system is an insurance-based system, which, like, when I was the coach at my son's debate team, so our 13-year-old does debate, and the students just kept being like, we need Medicaid for all, and we need this. And I'm like, but you keep going back to this insurance system. There are other countries that do it differently. And they're like, what? I'm like, yes, other places do it differently. So I think that is fundamental. I think that is something that we cannot exclude from these conversations for improving health and improving health for women and babies. The next thing is like safe and beautiful housing. I know people are like safe and affordable, but I'm like safe and beautiful, right? Like safe and lovely, safe and you'd want to live there, right? Because
Mhm.
like I grew up in Buffalo. The projects were like paid for, but like you wouldn't want to live there. I wouldn't want to live there either, right? Like
Mhm.
this publicly funded housing. And working here in DC, this publicly funded housing, rat infestations, mice infestations, mold, roaches. Like, I can't tell you, when I used to work in a clinic that served primarily people with Medicaid, how many forms I was filling out to like report, these landlords, right? Like, and you're getting, again, thousands and millions of dollars from the city, and the people that are living there are sick. So I want it to be safe, and I want it to be healthy, and I want it to be beautiful, because we all deserve that. Other things that we look at in other countries that have better outcomes, they have more midwives and primary care doctors providing pregnancy care for people, and not OBGYNs. Now, I love my OBGYN colleagues. I do. And if there is a problem, I want them on the case. But that average woman with a healthy pregnancy, she doesn't need someone that's trained in doing surgery, right? Like, she needs somebody who's trained in a natural, unsupported birth.
Uh-huh.
So, I mean, I did medical school. I saw all the interventions that you can do. And I would stay after hours with the midwives to see unmedicated and natural births. And my husband would be like, girl, you're pregnant yourself. You need to come home. I said, I'm never going to be able to see this stuff again. So I'm going to stay after hours with this midwife, right?
Mhm.
And be there with her. And that's the only reason why I got to see these births, because it doesn't happen between 9 and 4, right?
Right.
It could be she starts birthing at 12, and I know your rotation's over at 4, but you got to stay until 7 so that you can see this through to the end. And I did, waddling around the hospital with my pregnant belly, because I was on my OBGYN rotations while I was pregnant. I don't know what happened. And so our system needs to shift, right? So it is more people who are just trained in the natural, like minimal support. I'm going to be here if you need me, so that you cannot be stressed about that. But your body knows what to do, and your body's going to do what it needs to do. And you go ahead and get in the position that you need to get in. And we also don't have enough physicians, right? Like, we continue to not have enough doctors. So we're relying on a system that relies on OBGYNs, and we don't have enough of them. So it's like, again, make it make sense. Like, how is this supposed to work? Like, we have to train other people. So family medicine doctors, internal medicine doctors, med-peds doctors, OBGYNs, primary care providers are the center of birth care in so many other countries, and it's not here. And then lastly, paid universal wage. Like, I'm always, every chance I get, I talk about it. Paid universal wage, paid caregiver leave, right?
Mhm.
Like, it doesn't necessarily have to be only maternity leave. Like, in so many other countries as well, you can choose who you want to be a part of this year or 2 years that you are paid your salary, right?
Mhm.
Because, like, I know if you're paid your salary, you and your baby are going to have the food you need. You're going to have the safe and beautiful housing you need. And I'm not going to have to give you a little, crumbs of benefits later, because you're going to have what you need, and you're going to be stress free. Is it your grandma? Like, my dad is our nanny. He should have if I want him to watch the baby for 3 months, he should be able to get some of that, right? Because
Right.
Dad, I want to go back to work at 9 months. Can you do the last 3 months? My husband can't do it, but can you do it? Cool. You can use your year off or your 2 years off, whoever you want. And just think about what that would do.
Mhm.
Think about what that would do. Like, it would just shift so much of the stress. These parents are stressed because they got to go back to work. They are stressed because they don't have any maternity leave. They are stressed because, how am I going to keep my health insurance if I don't go back to work after 2 weeks? One of the medical techs that I worked with in that practice, again, like, she went back to work way too soon.
Mm.
And it's like, because if you are a contract worker, you don't get paid unless you work your hours. So she's like, girl, I'm not taking 4 weeks off. I'm going back at 2 weeks. And I'm just like, that's dangerous. And why would your boss let you do that?
Mhm.
Knowing it's dangerous. Right? So you asked, what does optimal support look like? Optimal support looks like what they do elsewhere. And it looks like rest, right? Like, you look at the Thai mommies, you look at our Asian mommies, they got 60 days. They can't leave a room except to go take a bath.
Right.
What would that do for us as
Yeah.
Black women with high mortality?
Yeah.
If you knew your mom, your mother-in-law, your cousins, your sisters, and the birth workers in the community were going to make it so you don't have to do anything other than wash your tail for 60 days, I bet you we would get this infant and maternal mortality turned right around.
Yes.
So that's my optimal support. I want us to go to the future and do the things that we need. But here, in the practical sense, I try to get people to take as much rest as they can. They tell me they're going back to work after 3 weeks. I'm like, so you chose me because you knew I was going to be honest. That's not going to work. And I'm like, how can we shift some things around, or what can we do? Or if you do absolutely have to go, can there be somebody literally sitting next to you that when the baby is done nursing, you can pass it to somebody else, and you can sit at your computer and you can type and you can do what you need to do?
Right.
because I don't want you getting mastitis because you're going to call me as your lactation medicine doctor and I'm going to have to write you some prescriptions. But I know this prescription is not really going to work because you're not getting the rest that you need.
Right.
And you're not emptying your breast like you need. And you're not resting like you need, like we talked about, right? And now you're back in the hospital with a hemorrhage and you're back in the hospital with high blood pressure.
Yeah.
It looks like other people cooking for you. Like, it was literally like when I was giving birth, the last time we had one of our friends set up a meal train, or you know what? I might have set up my own meal train. Like, I might have been like, I don't want your washcloths. I don't want your towels. I think I told one of my girlfriends that. And she was like, well, I actually put the towel in the mail already. And I was like, you didn't ask me what I wanted.
Right.
I would have told you, send me an Uber Eats gift card.
Mm-hmm.
$50 beautiful William and Sonoma towel that you sent me. Love you, Lindsay. I do. I love you, girl. But the $50 gift card from Uber Eats would have been like, that's really what I need because I don't want to cook today.
Yeah. And you could get me some hot, nourishing Thai food, girl.
Then can I get some pho? Can I get some delicious broth? Like, give me what the Asian mommies eat, right? Like, warm me up. All of that. I want all of that for them. And then just the full support of like a good pediatrician that you trust and that if something goes down, you call me. Literally, it's like, you just call me. Just call me. And if I need to, I'll come up to the hospital. I do courtesy visits for my patients who are in the intensive care unit more than a week. Do I get crazy looks from people sometimes? Like, why is your pediatrician here? Because I'm in the hospital for more than a week and she wants to make sure I get home safely. And then by the end, people are like, oh my God, thank you so much for coming here. But you told that mama it was weird.
Yeah.
Yeah, that was a story. So I can tell you this story. This was funny. I go and see patients who have been in the intensive care unit for more than a week if they're in a local hospital and I can like fit it in my schedule. So I don't like push it anywhere, but I tell people that.
Okay.
Listen, if you're there for longer, I will do what I need to do. I'll come see you. And so, I had babies that were born at the hospital preterm. I won't give any details, but one of the babies needed to be there longer. And, I'm talking to the midwife because we're texting and, we're not putting anything confidential and anything like, hey, our babies are doing good, or hey, like, call me, girl, I need to talk to you. And so I was like, okay, this baby's been there for a little while. I am going to be at GW anyway. Let me just stop by and see the baby. And so I'm texting the mom and I'm texting the midwife and I'm like, okay, like, talk to the social worker. So the mom says, Dr. J, the team called us and they told us that it was abnormal and odd that the pediatrician would come to the intensive care unit and wanted to be a part of rounds. And so, like, I get in my feelings, right? Because when you do things differently, sometimes you're like, am I doing it right? Like, maybe this is overstepping. Maybe this is too much. So I text my crew. I have a community of other pediatricians, some with more experience than me and some with the same experience. And I say, y'all, like, I'm kind of worried about this baby and the feeding. Like, I like to do these courtesy visits. Should I go? And they're like, girl, everybody should have a pediatrician that can go.
Yes.
They're like, do not let these people make you feel weird, right? Like, you should go. And where I trained in North Carolina, right? The doctors would just show up after the community doctors would just come in there after they're done for the day, or they come in there on their lunch break and they just be like, hey, y'all, I'm just here to support. I'm not trying to tell you how to do your job, but like, I'm coming to see my patient, right? And so I wanted to bring some of that sense here because folks need it. So I wrote back to the mom. I was just like, hey, like, I know that this is not what is usually done here, but where I was trained, the outside pediatrician would come and see the patients. Where I was trained, people would do this. I would really like to be a part of this because you want me to, right? Like, the mom also wanted me to. Right. I was like, just tell them I'm not coming in to make any suggestions. I'm just coming in to be a support. So I get to the hospital and, so the mom had talked to like her midwife and her midwife was like, Dr. J is right. Like, more pediatricians need to be able to do this if they can, and let her go in, let her just watch. So I get there and I like had lunch with the deans in the medical school because they're still my like friends and mentors. And I get there and the social worker comes up. Was it the social worker? The charge nurse comes up and, the charge nurse is like running things. Right. She's like, you can go stand in the corner. I was like, okay. Like, I'm not there to rock no boats. Have me standing in the corner. I still was here. I waved at the mom. I'm still here. You can bring me if you want to. So then the social worker comes over I hear her talking to the charge nurse. She's like, she's the pediatrician. She's been authorized to participate. She's just going to sit here. She's not going to talk. So then the charge nurse is like, the social worker's like, thank you so much for coming here. I know the mom is really happy that you're here. So I'm sitting there. The mom's like, Dr. J, I'm so happy you're here. She's like almost in tears. And I was like, I can stay for an hour. I don't know if the team is going to get to you during rounds, but like, I got to make my boundaries because I'll talk and I'll do all day. Remember, I told you, keep me to it, right? I don't have my visit anymore, so I can talk to you. We can keep going. So I'm sitting next to the mom. I'm on these like rocking chairs, which I've never sat in because I've never been like a patient in the NICU. I'm like helping her with her gown because she's sitting there nursing the baby. And the team is coming over and it's like a big team with like men, women. They've got these big carts. Have you ever been in the NICU? And so I'm like, girl, let me just cover you up. You got your breasts hanging out. It's cool. I'm fine with a breast, but they don't all need to see your breasts. And so they, are introducing everyone and they're just like, and so you're the pediatrician. And I'm like, yes, I am. Like, thank you guys so much. I am not here to make any suggestions. I am just here to support the family. I'm here from Healthy Home Pediatrics. If my patients are in the intensive care unit for more than a week, I make a courtesy visit. And so the attending doctor is like, yeah, I looked you up and like, so you went to school here. And she's like, yeah. And she's like, and you graduated like 1 year before me. I was like, oh. And she's just like, thank you for being here. Thank you for being here. And I'm like, cool. And so all those medical students, all those residents, all those fellows got to see somebody doing it a little different.
Yes.
And got to see how the mom was supported. So again, like I know that whole situation made me feel a little uncomfortable because I'm just like, they told the mom that what I'm doing is odd. And I'm like, you know what? It is odd because that's not what we do. But guess what? We're trying to improve outcomes. So we're going to do things
Different.
that maybe are a little non-traditional. But hopefully someday it becomes traditional again.
Yeah.
So that was one of my fun stories. It shows all the complexities of like my days and my weeks. That's what I go through with this like little practice of mine.
Yeah. I love that, Dr. J. Yes. So let's just shift a little bit. You touched on it a little bit earlier, but I want to touch on it just a little bit more because the people that may be watching this podcast and this episode in particular, you are dropping so many gems. And one of the things that I love is that you said, not verbatim, but do it scared, do it anyway. The time is never going to be right? It's not going to be perfect. Everything is not going to line up the way you think that it should line up, right? But it does align in divine order and divine timing when it should. Just like the universe told you, girl, I told you some time ago that you needed to leave, but you ain't listen. So here we go. Here's the situation, right? And as you did that, things started to align perfectly for you in that time, in that way. And so you mentioned that you do coaching, you do supporting, and you love on women who are thinking about or who are entrepreneurs, who are working. So you're not just supporting families. You are also supporting your community. You are supporting other practitioners, other entrepreneurs. And I would like for you just to talk about what that looks like. What does the coaching program look like? What does the internship program look like, Dr. J? Because Dr. J has an amazing internship program. We do have new doulas who watch this podcast and people who are thinking about birth work, right? What does birth work look like? What does going into a holistic health or wellness profession look like? And I always like to tell people it's limitless, right? It is what you make it. You do not have to be boxed in. You do not have to feel like, oh, well, I can only do this one thing. But you can integrate your natural abilities, your natural talents, your God-given talents you have, along with the skills and the experiences that you gain, and create something of inspiration and value for not only your families and the community, but the world at large. And we need more people who are willing to step out on faith, who are willing to say, I'm going to do it scared. I'm going to do it anyway. I'm going to do it even though I look weird or it's odd. Right. And so I would like for you to touch on that because you're doing amazing work. And for those that may be in the DMV area, when these opportunities arise, y'all need to hit up Dr. J and see what she has available. Okay. Because we're trying to grow this practice over there at Healthy Home Pediatrics. Okay. So Dr. J, what's coaching look like with you?
Yes. Oh my goodness. So the seeds, right? Like all of the divine nudging my first kind of like teaching roles were in residency, and I was nominated by the faculty to do like additional training and like teaching and leadership. And that was like the first thing that was like, oh, okay, I'm like really actually really good at this. And I guess also when I was in high school, I was a peer health educator and did a lot of like youth development work. So I just kept working on my teaching and coaching skills, but I didn't think that it would be something that I do later. I have amazing mentors. Shout out to Renique, shout out to Yolanda and Yolandra, like just outstanding Matthew mentors who all along the way were encouraging me and coaching me. And they all had a specific way of like seeing the brilliance in your student and letting them know that you see it, but pushing them to be even better, right? Like the best supervisors, the best coaches I've had have like been like, yeah, girl, you dope, but I bet you can do it even better, right? And so when I got to be an attending, I started working at GW as an adjunct professor doing the professional coaching program at GW for the medical students. And I loved it. And I loved my students. And it was wonderful. But my team and my husband, right, were like, this is a volunteer thing. You are doing a lot of hours of this volunteer work. And my like assistants would be like, I can't even schedule patients because you've got 8-hour sessions with the GW med students. And so, I would reach out to the GW faculty like, hey, I have a ton of experience. I'm in the community doing this work. Can you just give me an honorarium or something? You know what I mean? Like, I can't do this as a volunteer. And I'm like, you claim to be committed to diversity and inclusion, but like, I'm the only young Black woman here doing this coaching. Like the other folks can't do it because like you're not paying them anything. So every shift that I do with these students is costing me, it's costing my family, it's costing my business. And so I had to, after it was almost 2 years, I had to resign from it because every time I would tell these people, oh, like you think I'm doing good now, give me some money and watch what I can do. It would be, we don't have enough money for that. We can't fund that. But you've got all these old white men who have been running these programs forever who don't have the in the community entrepreneurship, building it up on my own experience that I have. And they are making 6 figures doing this work, but you're telling me I have to do it for free. So in my resignation, I put all of that in there. Like, this is the experience that the students need, but you don't want to pay me for it. I'm telling you it's impoverishing me and my family and my community, but you're saying, here's your free parking voucher. Here's your, and so all of that let me know that like people will do to you what you allow. And I was limiting how far I could go by doing this uncompensated work, right? Because it's not sustainable. It's not. If I am literally having full days where I can't schedule patients because I'm volunteering, again, it's impoverishing me and my family. And so the coaching and the leadership came from like these traditional tools. Sometimes like, yes, I have the traditional education. I can check off all the boxes, but a lot of times it's the out of school work, right? Like it's the additional training that I did in lactation. It's the additional training that I did in integrative medicine, that rotation that I chose. It's the additional training that I have in working with children with special needs. And none of that was formal, right? Like it was like programs that I found that I applied to or that I was nominated to. And so I started the internship program because like women were reaching out to me and being like, hey, I want to learn more about your practice. My medical school is not telling me anything about it. I know you were here because you were just one of our preceptors. And so, but I guess the reason why I started my internship program was one of my med students was like, hey girl, what you doing? Can I spend some time with you during the summer?
Right.
I was like, let's do this. And we did some awesome things during the summer. She came to this was during COVID. She came to all of our staff meetings. She got to see what we do. She got to see how we run through things. She would join the virtual visits with my patients and shadow me. And then I'd have her write a note just like she's the doctor. And I'd sign it just like I'm the supervisor. And she was a 2nd-year medical student, Elizabeth. And now she's a pediatrician now. And every year there'd be more people that were like, hey, girl, we heard this internship is popping. Like, or I heard you speak at UVA. Like, I heard you speak at University of Maryland. I want to spend time with you. And so then I just like made a program. And especially when I quit working at GW as the volunteer faculty, it was like, okay, I can't do hours and hours and hours all year, but I can give you a few hours each week. I
Mm-hmm.
can let you see what I do. You can contribute to my practice in a real way. I don't do busy work, but like, was this something that I had to do anyway? Can I give you a little section of it and we do it together? And now we've had more applicants than we've ever had. We had 11 applicants this past year, and I cannot say no. So my team, I have one of my team members, Beata. I was like, Beata, 6 of them were phenomenal. 2 of them, like, they were phenomenal, but like, I don't think they're the right fit.
Mm-hmm.
I'm like, how many should we take? And she's like, let's take all 6. We'll figure it out. And then we're like, okay, the 2 that were phenomenal, but don't fit. I'm like sending emails to like connect them to other people. Like, hey, I interviewed this medical student. He's amazing, but I just don't think he's going to fit with our team. Can you, are you interested in learning about him? I will coach you in how to make an internship program, and he can attend some of our sessions with us. So everything's not going to be on you. And they're like, send them my way. Tell me what to do and I'll do it. So all of the coaching and mentorship comes out of like, how do we spread this legacy? How do we make it so people have profitable? So actually, let me back up. Joyful, profitable, scalable, and sustainable businesses. Those 4 are like fundamental. Are you going to get joy out of this? Because if you're not, you should not be doing this.
Mm-hmm.
Is it going to be profitable so you're not impoverishing yourself and then so you don't have to quit? Scalable. Like, it can't always just be you forever. Like, it can't just be me. There's only so many patients I can see. There's only so many decisions I can make. And then, I'm 42 now. By the time I'm 50, I'm probably going to be like, listen, I'm about to get this gardening popping. Like, I'm not going to be seeing anymore, right? Like, so how can I scale it so that it's a package that I can give to the next generation? Like, here's your Healthy Home Pediatrics franchise, right? Like, I've got all the systems, but you make it your little thing. You do your thing a little differently over here. And then how can it be sustainable, right? Like, again, it can't be you doing every single thing forever because you get tired of all of that. So that's my coaching program. It has to do with students. It's the internship program, so I can stop doing this uncompensated work. It's launching a nonprofit. So I have like a nonprofit lawyer working on all my documents. I'm a little behind on sending out my board of director emails, but like, things take time.
Right.
That is okay.
Right.
When it's supposed to be launched, the nonprofit will be launched. She's been paid for.
Yes.
It's there. Get it in by the end of the year. It's okay. We're still going to do the work, right? We're still going to.
Yeah.
And then women, because like, especially women, they're my crew and we have differences. We have different energy when we're going into this, right? And we're inclusive, right? Like, we're inclusive. Like, some women ain't, like, it's like, we're like, it's all of us, right? It's the feminine, it's the more feminine energies. We ebb and we flow with our cycles. It's not always grow, grow, grow. Like, pregnancy during entrepreneurship, it was like, I can't look at how anybody else is doing things because mine doesn't look like yours.
Yes.
I got a newborn that's sitting here nursing. My daughter used to be kicking her little feet up. I'd be on my telemedicine calls and they're like, Omi's nursing. Yep, right here. And then she'd pop off and be like, I'm about to go back to this boob, like, And it's like, was I growing as much as I should have? No, I wasn't. But was I sustainable? Yep. Was I a little profitable? We got there. Yeah, we're profitable now. You know what I mean? It's going to look different and things are going to look different. So the coaching program is going to be time with me. It's going to be in a group because like, we as women, we do so much good work when we are in a collective. We have other women cheerleading us. I've done coaching where it's just me. I've done coaching where it's me and other women. I always do more when it's me and other women. So there's going to be group components. There'll be in-person components. Like, I spend a lot of money on this office. Y'all going to come to this office. Y'all going to come get some food. We're going to sit. You're going to take your shoes off. We're going to sit on the floor and we're going to talk and we're going to work through things together.
Yes.
If you're virtual, because some people will be afar, we'll have other things for you. But every now and then you're going to have to come down here. We're going to have to get together so I can hug up on you. The internship program, again, it's really like, I want these students to know what they deserve from the beginning. So when people start mistreating them, they're thinking, okay, now Dr. Jaden told me what happened with her first 2 jobs, right? Told me, like, you put your head down, you get your work done, you don't piss people off too much. But when dangerous shit happens, you note it, you keep note, and you just, you do what you got to do to get your paycheck, but know that you can't stay there. If they start doing dangerous stuff that you don't agree with, you got to find ways to report it, but like, I'll be here as a mentor so I can tell you what not to do.
Right.
What you shouldn't do. That's dangerous. Don't do that. Your boss did not want you to say that in the staff meeting, Jalan. I didn't know. I'm 26. I'm like, this is dangerous. Why is that okay? Don't say it in the staff meeting. I'm not supposed to write that in my evaluation. No, girl. Mm-hmm. You go talk to the person later. So I don't want them to make a lot of mistakes that I made. Yeah. And then just, to give people multiple ways that they can access me. Cause I know at this point, like, you got to pay me for my work. You got to pay me to spend time with me. And again, it's so that I can do well, so that I can see more people, so that I can bless my community, so that we go higher and higher instead of like struggling. The coaching program that I'm doing for women, I'll have online modules where people, maybe they can't afford to have me as their coach, as an individual coach or a group course, but I got a program for you that'll help you think about some things that the other programs might not be telling you.
Right.
But for you as a woman in healthcare, maybe a mom, maybe you're mothering in different ways, because mothering is also very inclusive, right? Like we mother each other in these groups. There's an online component. That one will come out in August, the program for women. And then my program where I coach people in person will be here, at my office, because this is where I am. This is where I am. Come out here.
Yeah. Yes. So, you summed that up, and you also told us what's coming. Like you're letting us know what's on the horizon, what's coming, which was my next question. But I would like for you to touch on, before we start to close out, the newborn program that you mentioned that is coming too.
Who I have here. Look what me and my mama made. She's got like the head leg and everything. So me and my mama, this is Ida. I spent way too much time on YouTube. So like we pieced her together, because like this is a body that you have to buy separately.
Yes.
And then you fill her up. So she got like booty cheeks and everything. This is my baby to teach people about baby wearing and latch. Like she can all of this. So hey, I'm sorry, girl. So the newborn course is because, again, like I can't be everybody's pediatrician, and there's also some stuff that I need my patients to know, but I'm not going to teach you about diapering, like during a visit. Like it just doesn't work, because I'm trying to make sure I keep you and the baby out of the hospital.
Right.
So the newborn course is going to be like around an hour. I think we're about like 64 minutes right now with filming. And it is all about the things that like over time, over these 15 years, well, I guess even more years when I was a babysitter, that are super important and that a lot of parents don't know. It's about the support, all the things we talked about today.
Right.
About, making sure you have a safe and healthy environment. It's baby wearing, it's diapering, it's caring for the baby, other demos in there, like paste bottle feeding, right? Like topic, making formula. Because, a lot of babies do end up getting formula, needing formula. Yeah, I'm really excited about it. I'm so excited. So yeah, the newborn course, and then the women in coaching course, because the universe was like, girl, I done told you need more people to know this.
Yes.
And my husband was like, I don't have enough money for it. My husband's like, babe, I got you. I'm going to invest in your business. And I'm like, I want a sugar daddy, right? But I'll take my husband, who's been, stepping up his side hustle game. He's like, I'm gonna invest in your business. And I'm just like in tears, like, wow. And my team, like you surround yourself with dope women who see your excellence and know what you need to do. My team have been telling me for 5 years, girl, you need to do some courses. And me, I'm over here like trying to write a book. And then I met with another neighbor who's a coach, and she's like, but people want your energy, right? She's like, maybe you're struggling for 5 years to finish that book, because the book ain't what you need to do. Maybe you need to do a course where people can hear you. Yes, Amanda, I hear you. Yes, I hear you. Yep. Yeah. And so here we go with courses. 2 courses, not 1 course, but 2 courses.
Yes.
In the book that still ain't done. That's been on the to-do list for 5 years.
In divine time and in order. Right now, we need these courses. Let's get these courses. Okay.
Let's do it. Let's get these courses.
Yes, Dr. J, how can people get in touch with you? How can they reach out to you? What are your ats? What is the social media? How can people talk to Dr. J, work with Dr. J, just love up on Dr. J?
Oh, yay. Come see me. Come through. So healthyhomepediatrics.com is my main website for pediatrics, all things families, newborns, adolescents. The internship program is also on there. So the link to the internship program, the nonprofit, we have a name. It is called Harmony in Practice. not balance, not, all that, but like harmony. We want harmonious lives. We want joy. We want sustainability. We want profit. We want all that. So that's Harmony in Practice, and it will be harmonyinpractice.org.
Okay.
Don't go there yet. We got a little draft up there, but we'll get there. It'll be there soon. Before the course comes out. And then social media is Healthy Home Peds, PEDS. That's on Instagram, Facebook, and LinkedIn. I've been doing more and more stuff on LinkedIn. I know people are pushing me to do that, so I will listen before it gets too loud. And it's like, girl, you should have been posting on there. I am not on TikTok, but maybe for Harmony in Practice. We'll see about that. So I'd say Instagram, LinkedIn are probably like the primary places.
Awesome. Well, before we close, I have a closing question that I ask all the guests before they leave us. And the question is, Dr. J, with all of your experience, all of your skills, all of the stories, everything that you have experienced in this life thus far, what would you tell little Dr. J?
Sweet. I cry like all the time. That's so sweet. Okay, I'm not going to cry too much. I would tell her that she's beautiful. I would tell her to not diminish who she is, because the people who are looking for you, they need your full shine. And whenever I tried to diminish my, like, I don't talk like the average doctor. Like, the average doctor is not going to do all of this. But whenever I don't do that, the people who are looking for me don't find me. And they have been looking for me, like even with my husband, we've been together for 18 years now. He is literally like one of the first men that knew I love science fiction, like down. We have the same favorite author, and he loves science fiction as much as me. And literally our first conversation was like, I geeked out. And I was like, I am a geek. You gonna know I'm a geek. I love me some Octavia Butler. It's like when you show up as your true, authentic, goofy self, whatever that may be, the people who are looking for you can find you. And when you don't, that's when you find people who are not for you. So this is me, right? Like my website, this is me. Am I goofy? Yes. Do I talk too much? Yes. If you don't want that, don't come here.
Yes.
If you do, listen, we're going to do some great things. Like, this is it. This is what I got. Like, right? This is it. Come here. If you're my people, come here. If you're not, stay away.
Yes.
And I'll do the same for you. So show up as your true self. Don't diminish your shine. The people who you're supposed to be with, they going to want you to shine great too, because they know if you shine great, they going to shine greater. And it just keeps going up and up and up. Like my crew is so dope these days.
Yes.
Because we're like, let's go. How high we going to go? Let's go. Let's keep going. Let's keep going. So that's what I tell my son. He is just like me. And I sometimes can see him diminishing his shine to fit it. And I'm like, them ain't the ones. Because if they were, you could shine brighter. And they'd be like, get it, get it, get it. Let's go. Get it, let's go. Hey, get it, right? So let's shine.
Yes.
Ooh, I'm going where you going, Shatia.
Yeah, I'm going where you going, Dr. J.
Where we going?
Where are we doing?
You tell me.
Let's make it happen, whatever it is. I love me some Dr. J. I love
you. It's been so dope getting to know you. I'm so proud of you. And when we get off the screen, I'm about to ask you about some of the things behind you. We'll talk products later.
Okay, absolutely. I want to thank everybody for joining today. I want to say, Dr. J, I love you. I thank you. I appreciate you. And I honor you for what you are doing. From the time that we met and from just this short period of time, you are such a light and you are a joy to be around. And I hope people watching today see that. And they feel that, because you are doing some dope stuff out here. And I am so grateful to know you. And thank you for spending your time with us today and allowing us to just soak in your energy, laugh with you, tear up with you, learn from you, and just be with you. I want to thank everybody for joining today. We will see you in the next episode. Thank you, Dr. J. Peace.